Roman reporting there now. After the criticism of its handling of donations to the Bali appeal, the Red Cross is again under fire, with at least 20,000 Australians saying they've been given a virtual death sentence after contracting the deadly hepatitis C virus from contaminated blood transfusions.
I believe the negligence is of the most heinous kind, which would border on the criminal.
I can't believe that they would put the blood back into the system or even consider making a product out of someone's blood that was contaminated.
It's one of Australia's worst public health scandals. Blood tainted with the deadly hepatitis C virus that was given to thousands of unsuspecting hospital patients in the late 80s and early 90s.
They should have erred on the side of caution rather than place hospital patients at any potential risk. I mean, this was unnecessary risk.
What makes this far more disturbing is that the Australian Red Cross Blood Service not only knew its blood products were contaminated at the time, it even encouraged donors carrying the virus to keep giving blood.
I got a transfusion from the Red Cross which was contaminated with hepatitis C. Okay? They have then asked me to donate my blood knowing it is contaminated with hepatitis C.
Michael Pollock is one of those donors. This is the Red Cross letter asking him to keep giving his tainted blood even after he raised serious concerns about it.
I was asking, are you sure you want my blood? My blood is bad, isn't it? You know, do you really want it? And they kept saying, yes, we do. We can use it. We can make products out of it. Yes, it will be safely treated to be made safe. No problem at all.
It was Michael Pollock who eventually blew the whistle on what the Red Cross had done, resulting in a federal government inquiry, which incredibly didn't even bother to ask him to give evidence.
Big cover-up going on. The whole thing's shrouded in secrecy.
The inquiry's findings are nothing more than a bureaucratic snow job. It centres on an incident in 1990 when 11 people contracted the disease through a blood bank in Gosford run by the New South Wales Health Service. It confirmed terrible errors of judgment had been made, and while a cheap screening test was available at the time, this was ignored because the Red Cross wasn't convinced it was effective. However, it overlooks the plight of an estimated 20,000 others given infected blood before and after this time.
I have been told, for the cost of 5 cents a bag, this could have been eliminated.
Donor screening techniques were there in the 1980s. They chose not to do anything about it.
Charles McKenzie of the Tainted Blood Products Action Group is outraged, demanding nothing less than a royal commission into the fiasco.
There's been no appropriate investigation, and there are people still out there walking time bombs who've been infected.
I didn't realise that it was a death sentence. And that is what it is. It's a death sentence.
Gillian Barker's husband Chris was 51 when he died from hepatitis C-related liver failure in 1988. She's convinced he acquired the disease from a blood transfusion.
The most dreadful thing is that people have been walking around for years without knowing that they've got this terrible disease.
The Australian Red Cross now faces civil action similar to one running in Canada, with compensation likely to run into the hundreds of millions of dollars. However, Canadian authorities have gone one step further, laying criminal charges.
Had they implemented it, they would have definitely screened out a lot of hepatitis C transmission and would have prevented hundreds and probably thousands of people from being infected with hepatitis C.
Tim McClement heads the Canadian lobby group suing Red Cross for its failure to introduce testing.
Through no fault of their own, these individuals trusted the healthcare system and it turned out to poison them. And in cases like Canada and obviously Australia, this was knowingly done where it could have been prevented, and there was a conscious decision made not to do it.
The Australian Red Cross argues the tests available at the time were not conclusive. Dr. Brenton Wiley is director of the Red Cross's blood products and tissue banking.
The question is what could be done about it, and at that time we couldn't make the blood supply 100% safe. No one could have made the blood supply 100% safe.
With more stringent controls in place today, people can have every confidence in the blood service. However, victims like Michael Pollock vow to keep fighting for justice.
I used to wonder how many people I'd actually infected, my blood. And seriously, I wonder now how many I've killed.